Namenda is a medicine that doesn't have a lot. I mean, it's got some dizziness and some headache, but other than that, it seems to be pretty well tolerated. If you have somebody who has depression and psychosis, you need to treat those things as well. There's kind of a lot of controversy about that. How do you do it? What medicines do you use for that? Probably can't get into all that tonight, but you usually, if they're delusional or if they're seeing things or hearing things, you pretty much have to treat that. There's a lot of times that folks will get really agitated with that stuff. So that, and then if they're in a nursing home, let's say, they may lose their place. The nursing home may say, we can't handle Mildred anymore. She's extremely agitated, paranoid. She's throwing food. She's knocking other patients over. And they'll say, well, you're going to have to find someplace else to put Mildred. And that's challenging because family members want the person close to them. In a small town, there may not be very many nursing homes. So agitation is a big issue. It can be a big issue. It's probably the #1 thing that leads a person to go into a nursing home from home because the family members are not able to handle it either. So you've probably seen some folks that have had agitation, I would think. It's difficult because the medicines we use for that can have side effects. They can make you sleepy, they can make folks fall and things like that. So you have to use just the right amount that doesn't make them have the side effects, but also helps. That's tough sometimes. Yeah.
Are people more likely that had maybe head injuries when they were young adults or whatever, are they more likely to get the dementia possibility when they get older and stuff?
It's an excellent question. The question was, are folks that have a head injury at some point, are they at some point in their life, really it could be younger, it could be really any time, are they at higher risk for getting Alzheimer's disease or dementia? And the answer is absolutely they are. And let's think about it. Why is that? Anything that you do that damages nerve cells in your life or brain cells, in your life, it already sets you back behind the 8 ball a little bit, right? I mean, if you have, like we talked about, if you have a good reserve going in, if you've got a pretty healthy brain that hasn't lost a whole lot of nerve cells, that's been used a lot, it's got a lot of connections and everything, those folks are probably at the least risk of having Alzheimer's. But the folks that have lost brain cells, whether that's using drugs, whether that's having some damage related to, let's say, Down syndrome, for an example. That's a genetic thing, but almost every Down syndrome, you're familiar with Down syndrome? Have you folks heard of that? Yeah, almost every person with Down syndrome will end up having Alzheimer's disease, and that's a genetic thing. But any type of pre-existing damage that's done to the brain, or damage through life that's done to the brain, think of all the boxers that that get dementia. Well, they've been just hit in the head so many times, they've lost a lot of nerve cells, and it sets them at risk for having dementia. Alzheimer's disease, the boxers, incidentally, may not be Alzheimer's dementia. They call it dementia pugilistica. It just means dementia from getting hit in the head over and over. And so don't pick up boxing. It's not so good, It's kind of funny, being a psychiatrist. I think about my kids, and I think, all the time I'm thinking about the nerve cells they might be losing. So a funny little story is when my kids were learning to walk, how they're top heavy and they always fall and hit their heads all the time. I kept thinking, boy, there goes 100 neurons. I teased my wife and said, I think we need to put helmets on these kids. And of course, everybody made fun of me. But anyway, anything like that. There's even evidence that folks that have the more concussions that you have, or even things that aren't as bad as concussions, playing soccer and a kid heads the ball. That probably is doing little teeny bits of damage to the brain. And the IQs, they did a little study where they looked at the IQs of kids that headed the ball versus kids that didn't in soccer, and the ones that didn't head it had a little higher IQ. So you watch the head. Make sure you protect your heads. So yeah, head injury is a risk factor for Alzheimer's disease. We didn't talk really much about genetics. I forgot to mention that, about other risk factors basically. But the question I get a lot is, Mom has Alzheimer's disease. What's my chances of having it? And I would say that certainly, like a lot of the psychiatric illnesses, there's a higher chance if you have a family member that has it. But it seems like the younger that the person gets Alzheimer's disease, that's when it's more genetic. So if you have a family member that got Alzheimer's at 50 or 55 or even 60, something like that, usually that's a pretty, first of all, the course in that is a lot quicker, but also there's a little higher incidence of that being genetically transmitted. So, but if you have a mother who, or you have a family member who was 85 and developed it, that may not be quite as genetic. So, a higher risk, but it's a little hard to put a number on it, and it's probably not as high as if it's a younger, a family member that's younger. The other thing I didn't mention, I should probably mention real quick, is that, again, we talked, like in depression, we talked about the alternative treatments and things, vitamin E and different things that estrogen, they tried to study estrogen to see if it might put off, prevent Alzheimer's, and it turns out it doesn't. Vitamin E, there have been studies both ways. There was a really pretty good study showing that a high dose of vitamin E, 1,000 twice a day, might help delay the progression of the illness. And so I used to use a lot of vitamin E with my folks. I'd say take 2,000 a day, just like the study would do. And I think that they did okay with it. Now, recently there was a study that came out and showed that there may be a higher incidence of heart problems with vitamin E, because they were studying to see if it might prevent heart disease too, and they ended up finding, well, no, it may actually not do that. It may be a little worse. The thing is, I guess, again, it's a risk and benefit thing. If you have Alzheimer's disease, but you got a pretty healthy heart, no heart attacks, and as far as you know, your blood vessels are pretty clean and everything, I think probably some vitamin E is not a bad idea. Maybe not the 2,000 international units a day like I was using before, but we don't really know what to use at this point. That dose is pretty high. But if they don't have any history of heart disease, I probably would say, take 400, 600, something like that. It's probably okay to do that. The problem is I can't tell you that would work as good as 2,000 because there's no study that showed that. The study showed 2,000 worked. So that's vitamin E. There are some other things that maybe have some validity in maybe helping prevent it. There's an Indian spice called curry that apparently, there's some feeling it might help. It's an antioxidant, I guess, and it might help delay or prevent Alzheimer's disease. There's also been some work with anti-inflammatories. Remember we talked about part of the cause of this is an inflammatory reaction in the brain. So somebody had the smart idea, well, let's try a steroid like prednisone, which cuts down inflammation. That didn't work. Or let's try, then they thought, well, let's try medicines like, the COX-2 inhibitors. I'm trying to think of like Vioxx. What's the other one though? There's one more. Celebrex. Thank you. I keep thinking Celexa. It's not Celexa. Celebrex. Medicines like Celebrex, and then also other anti-inflammatories, naproxen and ibuprofen and things like that. That's been mixed. It's certainly not a treatment for it. So if you have it, if you already have Alzheimer's disease, it's probably not going to do much for you. But there was one study that showed that if the patients that took them for 2 years, I think it was women, that took them, and I think it was ibuprofen, but don't quote me on that. You'd probably find that reference like on the internet through National Institute of Mental Health or the National Institute of Aging. But what they found was that folks that took those for 2 years or more had a lower incidence of Alzheimer's disease. So, that's still up in the air as far as I'm concerned. And there's risks with those too. There's risks of bleeding, and of course the Vioxx was withdrawn because of heart issues, cardiovascular safety issues. So any of these things, it's kind of you have to weigh the risks and benefits. And but if you already have, let's say you have arthritis or something, and you really need to take something for pain or some other inflammatory problem, and you got to take something, I'd probably take an anti-inflammatory and keep your dose reasonable, but that might help prevent things. At least at this point, we don't know for sure, but we'll find out, I'm sure, eventually.
What is the difference between what we used to call hardening of the arteries?
Okay.
Is that, I mean, I'm sure it's just a plaque or something, but I never heard of Alzheimer's disease, and it was always hardening of the arteries.
Yeah.
Now you never hear of hardening of the arteries anymore.
Right. You're talking about with the brain, hardening the arteries in the brain.
People, I used to, I knew people, they walk out in the middle of the night and go to the cemetery, and their minds just weren't right.
Right. They probably had Alzheimer's disease. The old days, the question was, what is hardening of the arteries, and is it related to Alzheimer's disease? In the old days, we didn't know what to call things very well, so we would call it senility. or we would call just old age,